Through much of my career, I've worked with scientific teams really thinking how to position a new technology to help patients. And the challenge is that can be a really broad application, but at some point you're going to have to start making bets to start to explore certain targets or indications or patient populations. And that exploration requires creativity, flexibility, a little bit of discipline, but a little bit of patience. And I think that exploration is what Flagship does best. I think what my experience in corporate strategy across all my different roles has offered me over time is really the chance to imagine with teams how their technologies could be applied to different diseases, targets, cell types, and patients. And I really enjoy being able to have that cross-functional dialogue where you are able to share all the different perspectives that are required to get a drug from idea to the clinic. And that's always been the most exciting part of my work. I come from a family of non-swimmers. Unfortunately, I had a running injury which kind of limited the number of miles I could put on, and so I was talking to my dad about maybe learning to swim as another form of exercise, and he looked at me and he said, "That is the biggest regret I have in my life, being afraid of water." And I thought, okay, well, gotta do it, make my dad proud. And there you go. If you fast forward a bit, you'll find me at the MIT pool, sticking my toe in the water. And I think the hardest challenge was getting used to the cold. But I learned in the fall, and I'm up to almost being able to swim a mile. So pretty excited about that progress.